Hello, everyone, and welcome to our webinar. My name is Michael Ritt. I'm a patient educator with the Stephen and Barbara Slaggie Families Cancer Education Center at Mayo Clinic. I'll be moderating our session today. The title of today's webinar is How Can Acupuncture Help? This session is being recorded. If you prefer not to be recorded, please feel free to leave the live session. Once available, the video recording will be posted in the video library on our cancer education blog on Mayo Clinic Connect. Mayo Clinic Connect is an online community where people can share experiences, find support, and exchange information with others. We encourage you to follow our cancer education blog on Mayo Clinic Connect to learn about other offerings and to access additional education, support, and cancer-related resources. I put a link to our cancer education blog in the chat, so feel free to check that out there. We will take questions at the end of the session. If you have questions related to this webinar topic, please type them in the Q&A on the main toolbar on your Zoom screen. I'm honored today to introduce our speaker for today. Jason Calva, a licensed acupuncturist with Mayo Clinic, is here to discuss how acupuncture may assist with symptom management and side effects related to your cancer care. Jason, I'll hand it over to you now for the presentation.
I'm a little shorter than Michael. Thank you for the introduction. I'm just going to imagine you have beautiful, wonderful, smiling faces in front of me here. My name is Jason Calva. I'm a doctor of acupuncture. I'm not a physician. I'm not an oncologist, but I do have a master's degree and a PhD in acupuncture, Chinese medicine specifically. And so I bring that up because a lot of people don't understand what it entails to become an acupuncturist. And so a lot of times you're a little bit leery on, if I go to see someone that's not at the Mayo Clinic, do they have adequate training? Are they going to understand how to treat me? And do they have a background in oncology? And so we'll explain at least what to look for to make sure someone is going to be safe and licensed in your area, just so that you know what an acupuncture practitioner, their training entails. And so I've been able to have the good fortune of being trained both in the United States as well as I lived in China for 3 years doing a PhD program treating primarily stroke patients, neuromuscular pain. But a lot of that training translated to be perfect for oncology care here at Mayo. In August, it will be 7 years that I've been working at Mayo. And I think a lot of times people are surprised that probably half of the patients that we treat in the outpatient acupuncture clinic here at Mayo is oncology patients. I'd say the number one would be just like headaches, neuromuscular pain, back pain, sciatica, and right below that is side effects of oncology care. And so we'll kind of go through, since this is for both adolescent and young adult, when I was kind of preparing and researching about what this group is and this topic, I didn't know that I was considered a young adult until last year. So 15 to 39 is the bracket from adolescence to young adult. And every 5 years of that bracket is going to be a very different clinical experience for you. And so I wanted to kind of explain what acupuncture is in the short sense, what we're going to experience when you get a treatment, but also just what does it mean to practice acupuncture as a body of Chinese medicine or holistic medicine. So let me share my screen with you here. Let me go right. There we go. So now I can see me. Hopefully you can see me as well as the slideshow. So when we say you're not your diagnosis, what acupuncture really as an indigenous practice in East Asia, in China specifically, is holistic medicine, which means that we don't look at you as being a cancer diagnosis. We look at you as an entire person. You all have very unique hopes, dreams, goals for the future. You have different interests, and your cancer diagnosis is going to impact all of those things very, very differently based on you as an individual. Move myself a little bit out of the way. And so when we practice holistically, a lot of times we're going to go through a list of what is it that you're actually referred for. So a lot of times you might be referred to acupuncture for pain management, either direct cancer pain, or it could be side effects of surgery, nausea, vomiting, those kinds of things from chemotherapy. And then after we get that initial part, we kind of go through a bunch of TMI questions where we want to really know, how are you processing stress? When you get stressed, does it disrupt your digestive system? Do you get loose stools? Do you become constipated? Do you hold stress or tension and worry in your body? Do you become really uptight and have a lot of tension in your neck, shoulders? How does it manifest for you? And then we want to know, how are you sleeping? How is your digestion? How is you as a person operating, so that we can come up with a more specific, detailed plan just for you, so that not only are we working on some of the side effects of the cancer and oncology care, but some of the other things going on in the background that might not be exactly what you referred to have acupuncture for, but is still part of your life and what you're experiencing. And so when we say it's part of integrative care, because with acupuncture, we're not treating cancer itself, we're just trying to make it so that your body is as resilient as possible to fight against cancer and the treatments that they entail. And so when we say integrative, when I started going to college for integrative health and healing, it was just changing from the term CAM. So at the time it was complementary and alternative medicine. And most of us that work in that field have realized that it's not an alternative. It's much more of an integrative approach, because we still want you to have access to standard medical care. We're trying to kind of fill in some of those gaps, because the lens, in a nutshell, from a Western understanding, is that if you have a disease, how do we remove that disease? How do we kill cancer cells? How do we do those types of things? Where in a holistic approach, the opposite is we're trying to focus more on you as the individual, to make sure that your body is more healthy to withstand everything that's going on. And so both of us, in a strictly Western approach or an Eastern approach, the integrative side is to work on both things at the same time. How do we make it so that you're getting rid of cancer, at the same time make it so that you have far less side effects of all the treatments that you're going through? And so depending on how old you are when you get this diagnosis, if you're, say, 16 years old and you're focused on just becoming social and boyfriends and girlfriends, and you're going to go to college, and then you get a cancer diagnosis, that completely disrupts your worldview. That's different than if you're 25. Or maybe you're 22 and you're about to graduate college, and all of a sudden, instead of focusing on like your career and everything that you've been aligned with the last 4 years of college, you realize, now my life is going to be focused directly on just my health for the meantime. If it's your late 20s, when friends are getting married and starting families, or maybe you've recently gotten married and you're trying to figure out, do we have kids, do we not? And then if a cancer diagnosis happens, then that changes a lot of the dynamics going on in your life. If you're in your early 30s, maybe you have small kids, that's also going to have a very different approach to your cancer care than, again, if you're 20 or anything like that. And so a lot of times when you're in this AYA grouping, the support groups aren't often built for people that are in your life stage. In your peers, when you look around, there's far less of you in that age bracket, where the older that you get, you're going to fit more and more into that typical cancer diagnosis. And so where we're trying to reach you is wherever that you're at. Whether it's more so anxiety and stress from the whole thing, or if your head's feeling okay, you feel like you've got a lot of good social support, family support, but it's literally just the pain or the nausea. we cater your treatment based on exactly what it is that you're going through. And so what acupuncture is actually. And so a lot of times the biggest thing that I'm asked is if it hurts. I brought some needles here because I didn't know if any of you would be in person. They come in these sterile packages. And so one of the interesting things with acupuncture is that they're so thin and fine that we even need a little tube that we call a guide tube or an insertion tube to make it so that the needle can actually go in your skin without it bending. And it's so thin, so fine that it's almost hard to see here. It's like a strand of hair more than it is a needle. So if you can't tell, it's bending right in front of me here. And so we usually will put them in these little tubes. And then that is how we'll put it on the skin and then just gently tap it in. So for most people, it feels like a mosquito bite. It doesn't feel like when you're getting an injection or you're getting a blood draw. Those needles are very, very thick and solid. These are very thin, very, very fine. They're like a stick of a strand of hair to make it so that it's relatively painless. You feel sensation, but I wouldn't say that it's necessarily painful. I think one of the first things that people realize is that it's extremely relaxing. I always joke that it's meditation for cheaters. So if you don't know how to quiet your mind, sit down, regulate your mood, we'll just gently put some needles in you, and it has a very calming and sedating effect. And so a lot of times the feeling that you have in the area locally where you're having acupunctures, it feels like a very kind of a warm or a heaviness or a distending kind of a feeling in there, but not necessarily excruciating pain or anything like that. And so what we're trying to do is to stimulate different parts of your body to promote what is called your parasympathetic tone. So anytime you're under a lot of stress, that's what we call go, 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 fight or flight. That's your sympathetic nervous system. And so obviously having a cancer diagnosis and going through oncology treatments is stressful on your body. And so the problem is we don't want you to chronically stay in this fight or flight response, because when you go into that mode, your body shuts down your rest and digest, or your parasympathetic state. And so that's when you want to feel calm and relaxed. It promotes digestion. As soon as you're stressed, your body thinks, hey, I have to outrun a tiger in the jungle. Let's shut down digestion. Let's shut down our immune system. And so your inflammation markers go a lot higher when your stress is higher. And so one of the things we understand from a Western perspective is that by stimulating the nerves on the body in a very gentle way, it allows you to move into more of that parasympathetic tone. So we've done studies with MRIs where someone will be in an MRI machine and then receive acupuncture. And the interesting thing is also the parts of the brain that experience pain, you'd think would become more alert when you're being poked with an acupuncture needle. But the interesting thing is that part of the brain actually gets quieter. So how we process pain, that area or that region of the brain actually becomes a little bit quieter, so that if you're feeling systemic inflammation, it helps that go down quite a bit. And so acupuncture has both what we call a local response as well as a systemic one. So one of the common things that we'll treat a lot, for example, is peripheral neuropathy from chemotherapy. And so if you're feeling lots of tingling or numbness in the hands and the feet, we might put needles locally near those areas where you have a lot of nerve blood flow. And so anytime you put something foreign in the body, it has a whole cascade of an inflammation response where it says, hey, we need white blood cells here. We need to fight off an infection, or something's a foreign invader. However, because the needles are surgical grade stainless steel, it allows your body to have a local response without actually causing something that would look like a mosquito bite or redness or irritation. And so that's the local response, is it brings more blood flow and circulation to an area. But the global response is that when you stimulate your peripheral nervous system, which is your hands, your feet, your central nervous system is your brain, your spinal cord. When we stimulate points on the hands and the feet, it stimulates your body in a way that it moves you into that relaxed response. So most people would fall asleep in an acupuncture treatment. And so we're always taking into account if someone else has like low platelet counts. I'd say half of our patients are on blood thinners of different kinds or immune compromised. The risk of acupuncture is not zero, but it's as absolutely close to zero as we can be that your oncology team is going to feel comfortable with. And so in Chinese medicine, I have a little acupuncture doll here. We'll just call her Martha. If you've ever seen charts of acupuncture, they look like these dots or these lines all over the body. So a lot of times people will be like, why are you putting something down in my legs when I've got abdominal pain? And that's because the theory in Chinese medicine is that by stimulating these channels that relate to the organs, you can help reduce the pain in the local area where you're feeling it by stimulating the hands and the feet. And so keeping in mind that the system of acupuncture is over 2,000 years old, and they didn't have MRI machines, they didn't have x-rays, and so their understanding of how the body worked was different. And so when they use language, when they talk about qi or vital energy or things like that, sometimes it can sound very either new agey or woo-woo, for lack of a better term. But it's just because it's being translated from a language that's trying to discuss your body in poetic language, in a poetic sense. Not that they all literally take it to mean that these channels are flowing in a certain way. Most of the meridians in Chinese medicine are going to map over our nervous system very, very well. And so I think that if you could take a Chinese acupuncturist from 1,000 years ago and show them an MRI right now, they would modify and adopt their treatments the way that they do in mainland China today when I've been there, and how we practice, here at Mayo. And so the most common things that we would be treating is going to be nausea, fatigue, chemo brain. Anytime people come in and they have a lot of brain fog, this is one of the biggest things. So the fatigue, because of everything that your body's going through when you're in chemotherapy or you're going through radiation, your body is at the same time trying to repair all of your healthy cells as fast as it can, which has a very draining effect on you. And so one of the things that we can do is by promoting more of a parasympathetic tone in your nervous system, reducing stress as hormones in your body, cortisol, things like that, reducing inflammation, it helps with the nausea, the fatigue, and the overall pain. And so if we can make sure that your anxiety and sleep is doing better, that means that your body is going to handle all of the oncology care that much easier. If you're under a lot of stress, if you're having a lot of inflammation and pain, any intervention that you have from your oncology team is going to be harder on you. The more relaxed you are, the better you're sleeping. It's going to make it so that your body is far more resilient for everything else that you're going through. And so we treat oncology patients through the entire range of wherever that you're at. I think some people are surprised that as soon as they have a diagnosis of cancer, if you're here at Mayo, a lot of times the oncology team will refer you to massage therapy, to acupuncture, to take mindfulness classes and things like that, because it is such a daunting experience to just have that diagnosis. And so before you've even actively started, chemotherapy, or maybe you're still doing biopsies, or you haven't had surgery yet, we're immediately going to start working on your anxiety, your sleep, and just overall inflammation. And once you start feeling like you understand the process of what you're going to be going through, once you start going through chemo and start having treatments, then when you're throughout active treatment, we're trying to reduce usually the chemotherapy radiation side effects as much as possible. So that's the neuropathy, nausea, sleep, radiation burns, things like that is what we treat pretty frequently throughout that time. Just to make sure, again, if your body can be more calm, more relaxed, you're going to get through the chemotherapy treatments a whole lot easier. And then towards the end, once you're gone through all of your treatments actively and you're in survivorship, a lot of times people will feel like it's overwhelming because when you're in treatment, at least you have a game plan, at least you know what you're doing week to week. Once all of a sudden you ring the gong and you've had your last chemotherapy treatment, it can feel like, now what? What do I do? Where do I go? And it can feel like you're just waiting to find out, like, has cancer returned and things like that. And so what we're trying to do at that point is to, again, make sure that you feel like you're still actively participating in your health, in your wellness. We're still always talking about sleep and digestion and seeing how stress is affecting you, to just make sure that we can make survivorship be the rest of your life. And so when you feel like there's not much you can do after your active treatment, that's where we're trying to kind of give more of that wellness, that lifestyle approach. And so I always say in Western medicine, it's like if you're at 100% health, once you drop below 60, and then we need to go and see a physician or you're getting treatments. Once we know that you're safe and you're going to make through everything, we get to this plateau where now maybe you're only at 62% of feeling healthy. You're no longer in a crisis mode, but there's a big gap between what you want to be feeling and where you are now. And that is where integrative care is going to help gently coax your body, your nervous system back into that optimal level of health. And as much as everyone hates to hear what new normal is, we want that normal for you to be as high of a threshold as possible, so that your quality of life is where you want it to be. And so the other thing that we treat a lot of here at Mayo anyway is we always ask the caregivers to get a referral for acupuncture or to see us in the Rejuvenate Spa for care, because whether it's your children or your spouse or a close friend that you're helping take care of, all of that is a burden for you. And in Asia, they'll have different phrases like you can't pour from an empty cup or you can't serve people on an empty stomach. And it just means that you, in order to be effectively helping your friends, your family, and people that you care about, you also need to make sure that you're taking care of yourself and not being overwhelmed by stress and anxiety. And so we treat a lot of caregivers as well. And I feel like I wish as soon as anyone in a family gets a cancer diagnosis that them and everyone around them starts having access to integrative therapies. Whether you're not a fan of needles and you don't want acupuncture, but massage sounds good, or learning meditation, mindfulness, those types of things, anything that makes you feel calm, happy, safe in your body is going to be beneficial for you as well. And so one of the things that's hard for us to navigate at times is that the range of how much your insurance covers for your oncology care varies widely. And so we always ask people to check with their insurance companies to know what level of care do they cover, how many visits do they cover, do they only cover 12 in a year, or do you get 20 visits in a year? And all of that will dictate how we decide how frequently we want to see you and those types of things. And so a lot of clinics if you're going into private practice, acupuncturists will often do sliding scales and do what's called the community style acupuncture, or they'll have special rates for people who are under some kind of financial burden. And then if they do take insurance, it's just understanding that they're billing for the right things. And so everyone that comes in, when they ask, does my insurance company cover this? The hard part is you need a PhD just in insurance billing to fully understand if it does or does not. So we just say, call them, check and see. Usually if it's for oncology related pain, coverage is easier than if you just had, say, neck pain, for example. And so at the Mayo Clinic here, how it works is that if your physician, your primary care, or even someone in your oncology team sends you a referral for acupuncture, we are seeing people here in the outpatient practice. And so integrative medicine and health is part of what's called general internal medicine. And so it's all outpatient. And there's 8 of us who are treating people all day long. And we have both what's called individual acupuncture and group acupuncture. individual is exactly what it sounds, where you come in and we just talk to you one-on-one and you get a private treatment. And it is actually oncology care that made us push or advocate for doing a group practice, because this is actually closer to how they practice in Asia. When I was in China and could see that they would treat a higher volume of people, is because you'd walk into a room and everyone that was in that room had either headaches or women's health or oncology care. And so everyone is getting a very specific, detailed protocol for what they're going through. And so with group acupuncture, you're still not staring at each other. All that means is that you're in a big room with cubicles. So we have the same massage tables, those kinds of things, heat lamps, infrared light, to make sure that you're calm and that you're warm and it's a nice, soothing ambiance. But we're able to get through more people at one time. We can see 4 people in an hour instead of just seeing 1 person in an hour. And if someone doesn't have a referral from their physician, they can also just self-refer themselves to the Rejuvenate Spa here at the Mayo Clinic and pay out of pocket. And that's $199 if they're brand new to Mayo, where we'll do a more thorough intake, and then $140 for their return visits. And so a lot of times we'll have patients that are doing that if they're just here for a couple weeks and they don't have time to wait to get on our wait list for things like that. But if they're going to be here for any prolonged period, then we would obviously recommend that they get a referral so that we can bill their insurance, see them more frequently. And if you're not local to Mayo, or you're here for a little while and then you'll be going home, you can look at our board certification is ncbahm.org. That's the National Certification Board for Acupuncture and Herbal Medicine. And so that means that anyone on that list has at least a master's degree. Most of the field is moving towards a doctorate, and they've passed different board exams to make sure that they're safe. They know to look for red flags. They know what areas are safe to work on for oncology patients. And I still recommend that you ask if you see a provider's website and they don't specifically state that they have oncology training, I would just ask them, like, have you had a lot of experience working with cancer patients? And have you had experience working with people in my age range? And not all of them need to have specific high-level training that we do at Mayo, but they at least need experience and understanding. And I always say, you gotta feel it out. If you meet someone, and a lot of times you can just do an intake and not get a treatment, and if anything feels off or unsafe, by all means, just walk out of that clinic. That's the thing where at Mayo, I think we want patients when they go elsewhere to also hold their providers to a high level of standards of cleanliness, of safety, because at the end of the day, we have to make sure that all of our supplies are clean, and we have to make sure that that working with your care team, that there's no red flags from them that they don't want you to have acupuncture. So always check with your physicians, with your oncology team, to make sure that they're okay with this being as part of your plan of care. And then from there, it's just finding a provider that has specific training to what side effects and what types of cancer that you've been diagnosed with. So that's my overall spiel. And
You stop the share. We can see if there's any.
yeah, let's see if you guys have anything that's come up. Q&A. The biggest contraindications would that be, so if you can't see it, it says, I would like to know the contraindications for the use of acupuncture in oncology patients and whether there's a minimum platelet count that you consider safe. Yes and yes. The biggest contraindications are going to be basically that if your immune system is too compromised, if your platelets are too low, and I should have checked right before I looked, but we have markers right at our desk that shows all the different biomarkers that if you're in any of these ranges that we don't want to see. And so I can get back to you on that. But that would probably be the biggest concern. Obviously, if someone is so sick, there have been times where I have patients that are so nauseous that they're throwing up in the middle of treatments. And so we'll do some things with acupressure or massage or different things like that, or maybe we'll use gentle, call them press tacks, where it's like a little tiny baby needle with like a seed or a bead that we kind of put in the ears to help if someone needs to get up and move around because they're throwing up. Obviously, we don't want them to have needles in them. If someone is in such excruciating pain that they can't lay comfortably. Now, here at Mayo, we have very, very nice tables that we can move and adjust them in lots of different ways to lay on your side or to tip you up forward, or we can do all these types of things. But if the pain is so severe that you can't be comfortable, and most of the time it'd be like radiation burns for like breast cancer patients or any types of like mouth cancers where everything is so painful in that moment that you can barely function, we'd say, let's just wait until you're at least at a point where we can feel like your pain levels are a little bit more manageable. That being said, there have been times where I have a couple instances where someone couldn't sleep because the pain was so bad because of the radiation burns. And so one of the only times they could sleep or take a nap is when we propped them up comfortably and then gave them acupuncture, and they would fall asleep within 5 minutes and sleep the entire hour until their treatment was up. And so the biggest thing for us is going to be, as long as the risk of infection is going to be low and that the platelet count is going to be high enough, is going to be the biggest thing. The other things is more so like we never needle locally in the cancer site. And so it's more so contraindicated of where I'm doing something, or if someone has had lymph nodes removed, we usually are not going to be needling on that arm that has the lymph nodes removed because for lymphedema and risk of infection being higher. And so even if it's not so much that they can't have acupuncture, there still might be contraindications in the parts of their body that we do or do not want to work on. And so that point, we would either work on scalp or the ears or the opposite limb or your feet to treat you instead of needling locally where you have cancer pain, things like that. So it's complicated. And so that's why it's helpful for us at Mayo that we have access to all of your health records, because we know all of the different surgeries that you've gone through or what your active other treatments are. Whereas when you see someone out in the public, it's really important that you can share all that information with them. So, all right. Thank you guys so much. I appreciate, just hanging out with me on a early morning, afternoon, depending on where you're at here in the States. We love oncology care here at Mayo Clinic, and anything we can do to help support all of our patients. We're just cheerleaders for your care. And so thank you guys so much for having me. If you have any questions, go ahead, ask your team. So thank you, Michael.
Thank you so much, Jason, for your time today. Thank you, everybody, for participating in our webinar. We hope the information was helpful for you. You can click on the link in the chat to see and learn more about all of our other offerings and access additional education, support, and cancer-related resources. So please feel free to do that at your leisure. When this webinar is ended and you choose to exit, you're going to be prompted to take a quick survey. It's 4 questions, so really short. We appreciate your willingness to fill out this survey, as your feedback is helpful to us to ensure we are offering educational opportunities available that are appropriate and valuable to you. So thank you again for joining us, and have a great rest of your day.